Ready? Hi, my name is Jessica Marks, and I'm actually going to be reporting some statistics and facts about medication, prescription pain medication being used and abused in the United States. Here are the facts and the statistics, and then I'll allow you the opportunity to determine where the problem lies and then how we can resolve it, because what we're doing isn't working, nor are we putting any money towards it. As a country, 7 million Americans are abusing prescription drugs every day. More than the total number of people that abuse cocaine, heroin, hallucinogens, ecstasy, and inhalants combined are abusing prescription painkillers. In the past 3 days, 6,000 teens used prescription drugs without a prescription. They stole it out of a parent's medicine cabinet. They got it from a family member or a friend. Either way, it was legally obtained, and they did it without a prescription. In 2000 study, there was, in a study done in 2007, 700,000 adults illegally obtained prescription drugs online. That probably is a pretty good indication of where these 6,000 teens are getting their prescriptions. The definition of prescription drug abuse as we go through this is basically stated simply: taking a prescription medication that is not A, prescribed for you, or B, taking it for reasons or in doses other than as your doctor has prescribed. In a White House study done, we've had a 400% increase in prescription drug abuse between the years of 1998 and 2008. The prescription drug-related emergency room visits have doubled in a 4-year period. NIDA, which I'll refer to as NIDA, means National Institute of Drug Addiction. It's an entity of the National Institute of Health, and they've done lots of research and multiple studies. In 2010, which is the most recent, NIDA funded a specific study on teens using pain medication. There was 2.7 in 2010, so last year, of 8th graders that abused Vicodin. 7.7% of 10th graders have abused Vicodin, and 8% of all the seniors and 12th graders in our high schools, 8% of them are abusing Vicodin. Of teens that are using OxyContin, or oxycodone, so to speak, 2.1% of 8th graders are abusing that. 8th grade, they aren't even in high school. They legally can't even drive, and they're popping pain medication. 4.6% of our 10th graders and 5.1% of our 12th graders are abusing OxyContin or oxycodone. In 1 year, between 2002 and 2003, abuse of oxycodone increased 10% among those teenage Americans from 12 to 17, and 60% of adults, a 60% increase in adults from 2002 to 2003 in 1 year. The problem, another huge problem with this, is the acetaminophen, the Tylenol, that goes into these pain medications that they take. 200 million prescriptions for pain medication containing Tylenol is prescribed every year, 200 million. In the U.S. alone, 42,000 people required hospital care for Tylenol overdoses. 400 of those people died. The Tylenol problem continues to rise. The FDA suggests a maximum of 4,000 milligrams a day. The average Vicodin prescription actually states you can take 1 to 2 tablets every 2 to 4 hours, which, if you do the math, that's 6,000 milligrams. That's 1.5 times what the FDA states is safe for a person to take. And the question that I have for you is it the physicians? We don't know. So that's up to you to decide. The problem, physicians are only receiving 2 hours of training and the entire time that they're in school learning how to divert prescription drug abuse. 2 hours, and the entire time they go to school, before they meet with you, that's all they've received for training. Columbia University pulled these doctors, and only 57% think that they can help with this prescription drug problem. It's so easily obtained in Ohio, in fact, that pharmacies in Ohio alone fill 2.7 million painkiller prescriptions in 1 year. Facts for Florida, for example, we'll use them for an example. Right now, they have 250 physicians board certified to manage pain and to prescribe prescriptions for pain management. 250 physicians, but there's 18 million people that live in Florida. That's a problem, because 9 million of the people that live in Florida, half of the people that live in Florida, are visiting doctors for pain treatment every year. That's half of our population. Florida is right now trying to pass a monitoring program, which I'm surprised has not already been implemented prior to this time, to monitor the number of painkiller prescriptions that go out. It barely passed last year, and which took them 3 attempts. They tried to pass it 3 different times, and it's failed. But now that it's been approved, the price tag's too high. We can't fund it. It continues to escalate nationally, even beyond Florida. Even though we have monitoring programs in 33 states, 9 others have just now passed legislation, although, as we talked about before, in 2002, 2003, the problem has doubled. So why are we just looking at this now? And then, of course, we run into budget problems. They can't afford to get them off the ground and get them going. The monitoring programs will help avoid doctor shopping, the definition of which is multiple prescriptions by multiple doctors. The program will hopefully help prevent the deaths that occur every year due to prescription painkiller abuse. Paul Sloan is an executive director of Florida Society of Pain Management Providers, and he quotes, "All these people are dying by buying and or stealing these. They're not dying because a doctor says, here are 250 Oxycontins, go home and eat them." So he doesn't think they're the problem. On the flip side, Washington state lawmakers that are trying to get tougher on the laws for doctors that are prescribing pain meds for this year but they're passing the toughest regulations yet. So they must think that the problem lies with the doctor. And that's what we're here to determine. Representative James Mueller, he attributes most of addiction to physicians overprescribing the medications. Physicians prescribing strong medications for problems like strained leg muscles, headaches that Tylenol or ibuprofen can resolve. They're giving people pain medication. It's addicting them. And patients are wanting to go see that doctor over and over and over again to get more meds. Dentists are giving out 30-day supplies for a 3-day tooth problem. It could be resolved, like I said, with over-the-counter ibuprofen, Tylenol. Why are we exposing people to the possibility of abuse? The new laws requires doctors to refer patients with an ongoing pain issue to physicians that are certified to handle pain management. Further programs are allowing pharmacist assistants to access the prescription drug database so they can keep an eye on their patients. Right now, as it sits, they can't even, the pharmacy assistants can't even look into this program. So when people are filling these prescriptions, they know that they shouldn't be. They know it's for abuse. They can't do anything about it. And one pharmacist for the whole pharmacy can't look at all that. There's not enough time or money. The NEDA director is Nora D. Volkow. Sorry, I'm not sure how to pronounce that name. She is a medical doctor, and she wrote an article stating that NEDA is attempting to respond to the increase in prescription drug abuse on several fronts. In September of 2010, a panel of experts attempted to decrease addiction. NEDA is working to develop screening and diagnostic tools to aid physicians in determining the potential for misuse and abuse and dependence, which is back where we said they're only receiving 2 hours of training. They're also developing new medications that are free of potential for abuse or diversion to illegal markets, and trying to find medications that don't have Tylenol and other medications that are hurting people and killing them every day. they're also working to understand more fully the role of environmental and social factors in the misuse and abuse of prescription medications. For example, how great a threat is posed by internet sites offering controlled substances for sale. And that's our problem right there, is the internet. Do some healthcare professionals excuse me, just one second here. And then these are questions Nita is posing. Do some healthcare professionals aid to the abuse by inappropriately prescribing? Do providers give inadequate treatment because they fear their patients will become addicted? If these are significant, what educational efforts will most effectively guide physicians in prescribing appropriate medications for appropriate patients who actually need them? You know, when I think about a physician, I think about they're actually a client for this physician, so if he continues to prescribe medications, that person's going to keep coming back. And they get monthly prescriptions, so they know that they have to see them every month, and that doctor depends on that income. Consider Florida. Half of the people that live in Florida are getting prescriptions every day for this medication. The other problem is the client has a toothache, knows if they need pain pills, they'll go to the dentist every 6 months. Why would that dentist or that physician not prescribe the meds if they know that that patient is coming back to get those medications? That is guaranteed income for them. Pain management doctors, why would you want to send your patient to a pain management doctor? You're losing that income, therefore getting their income up. But let's say that you do. Then you have the pain medication doctor or the pain management doctor. His income is being increased. And why would he try to resolve the pain for the patient? Because the pain medications is what's keeping these doctors, some of them, afloat. And the pharmacist, what's their role? Constantly questioning and researching patients' medical history. They need to be constantly quizzing the doctors and marking up the pain medications, which affects the people that actually need them. And attempts to resolve it, I would have to say, I'm asking you, how can we resolve this issue? No one wants to take a tougher stance because it costs more money, but at the same time, people are dying every day from this problem, and we're keeping our doctors in business doing what we are allowing to kill people every day. So, like I said, where does it stop? Where does the cycle stop? The money is being made, and these doctors are trying to stay afloat, but we have to figure out how to stop that cycle. So that's my question to you, is how do we do it? And this is the information that you need to make that decision.